make me move. And on and on and on. Una, dos, tres, hey! We are heroes tonight. There's a reason why we lose.
Hello, and let us start with the next chapter, that is international health. Under this chapter, international health, world is becoming a smaller place, and the health becomes not preview of only one agency. Many agencies will be working to promote health. And because the world is a smaller place, it's not only for Indian government, it is many other international agencies come to play to work for promoting health in any country. So in this chapter, we are going to talk about the international health agencies. We will talk about bioterrorism agents, and we will talk about the notifiable diseases. So first, let us talk about the international health agencies which are working for promoting health and safeguarding health in India as well as outside. So international health agencies, we are going to talk multiple health agencies, not only the listed ones, like WHO, UNICEF, FAO, ILO, UNDP, World Bank, USAID, Red Cross, Rockefeller Foundation, Ford Foundations, and some other agencies. Let us start with the first health agency, that is WHO. WHO is World Health Organization. MCQs on World Health Organization. The WHO or the World Health Organization, way back in somewhere in 1902, the first organization was started, which was the Pan American Sanitary Bureau. Pan American Sanitary Bureau. This was the first organization which worked on health. Followed by 1902-1923, we had a health organization of League of Nations. League of Nations. And followed by that on 1948, in 1948 on 7th of April, there was formation of the World Health Organization. So MCQ could be which was the first organization or the mother organization of WHO. It was Pan American Sanitary Bureau. It holds an historical importance. If you talk about the World Health Organization, the emblem, the symbol you can see on your screen right now, the headquarters of World Health Organization are located in Geneva, which is in Switzerland, which is a beautiful country. Geneva in Switzerland is the headquarters. If you talk about the functions of the World Health Organizations, the functions of World Health Organization could be first and foremost is the prevention and control of diseases. That is, of course, the first function. The second is family health. This can be a question that which of the following is a function, which of the following is not a function. Third is to do research and statistical analysis. Statistical analysis of data. That means to find out which disease is happening more, which is happening less. Next is to do research on biomedical research for improving the diagnostic capacities, pathological facilities, or biochemical tests or things like this. And fifth and foremost is environmental health. Environmental health. So these are important functions of the World Health Organization. Next is what is the organization of the WHO. If you talk about the organization of the WHO may be categorized into three broad areas. You have first of all the Secretariat. The Secretariat gives you the administrative support. It gives you the managerial functions. It gives us the managerial functions and the administrative support. The second is one of the most crucial, the main core of the system is the executive body. Executive body is composed of 34 members from representative from each states, 34 members, representative from each country, and out of this 34, 1/3 of the members are renewed annually, every year. They are renewed every year. The third section, the third category is the World Health Assembly. The World Health Assembly. What is WHO? World Health Assembly. It contains a representation from all the member countries, and the World Health Assembly is the main governing council. It is going to do approval of the projects. The World Health Assembly is for final approval of all the projects under the World Health Organization. If you talk about the World Health Organization, regional offices across the globe. So if you see the regional offices, the WHO is further divided into regional offices. We have these 6 regional offices across the globe. You have 7 continents. Greenland does not have an office. We have 6 regional offices. 1 office for our area, Southeast Asia. 1 office for whole of Africa. 1 office for the America, which includes the US and the Canada and the Latin America. 1 office for Europe, 1 office for East Mediterranean, and 1 office for the Western Pacific. The head offices of each of them are important, and many times this has been a 5-star question to you. The South Africa is in New Delhi. The Africa office is in Congo. America is in Washington, DC. Washington, DC. And for Europe, it's in Copenhagen, which is in Denmark. Eastern Mediterranean is in Alexandria, which is in Egypt. Alexandria, which is in Egypt. And we have the last one, that is Western Pacific. It is in Manila, Philippines. So these are your World Health Organization regional offices across the globe. The next we can discuss is United Nations International Children Emergency Fund. The logo you can see on the screen. This is UNICEF, which we commonly called as UNICEF, United Nations International Children Emergency Fund. Remember, the word is emergency fund. It was formulated in 1946, and the headquarters is in New York, US. The headquarters is in New York, US, and basically the UNICEF is no-brainer MCQ. UNICEF is functioning for what? It is functioning for mother and child health. It is basically functioning for mother and child health. It works for nutrition. It works for immunization. It works for education of the children and welfare. Under this program, we have had the history of seeing so many big initiatives. Example for this could be BFHIs, which are baby friendly hospital initiatives, which is to promote breastfeeding. We also saw another program, big program, that is Gobi FFF. Gobi FFF. What is Gobi FFF? G stands for growth monitoring. Growth monitoring. O stands for ORS, that is oral rehydration solution. B stands for breastfeeding. Breastfeeding. I stands for immunization. I stands for immunization. So these were your basic principles of Gobi: growth monitoring of the children, ORS, oral rehydration solutions, breastfeeding, and immunization. Along with that, there is element of family planning, food to the mother, and there is element of female literacy. So it is, if you combine all these things, the triple F, and you combine the Gobi, basically it is to promote child survival. The child is going to live only if the family or the mother specifically is having a Gobi FFF. So these are your elements of UNICEF. Next is Food and Agricultural Organization. The logo are important, and you can see on the screen is FAO. FAO has the headquarters in Rome. It was formulated in year 1945, just around the UNICEF time, 1946 for UNICEF, 1945 for the FAO. So Food and Agricultural Organization, it's actually a part of the WHO. And it is responsible for the quantity and the quality of food production, food consumption, food production and consumption, including fisheries and farming across the globe. So it is basically to capacitate every country in the world to have its own food production and consumption, and of course import and export. It also functions for improvement of the condition of farmers in the rural area. Farmers in the rural area. So this is what is FAO. Next is ILO. ILO was formulated in year 1990. The headquarters is in Geneva, which is in Switzerland, along with the WHO office. So ILO was formulated in 1919 in Geneva. It is basically for labor organization. It is for what? It is for labor organization. So it is to promote social justice. It is to promote social justice and economic and social stability among the population. Economic and social stability among the population, that is the function of ILO. Next is this program, United Nations Development Program, UNDP. The UNDP has its office in New York. It was formulated in year 1966. The UNDP is having this emblem of WHO inside, so it tells you that it's a body of WHO, although the office is not in Geneva, it's in New York, US, and but the UNDP is functioning for manpower, is functioning for human and natural resources. How to utilize maximally the human and the natural resources is what is the function of UNDP. Another is UNFPA. Another program is UNFPA. What is UNFPA? United Nations Fund for Population Activities. The United Nations Fund for Population Activities will work on what? It will work on population. It works on the family planning. It works for family planning, and it is working for the mother and child health overall. So UNFPA, UNDP. Remember, UNDP is for overall human resources and the natural resources. Next is the World Bank. World Bank is a UN agency. It is UN agency. What does United Nations stand for? United Nations or UN is a peacekeeping force. UN is a peacekeeping force. So basically World Bank is funding things or materials or resources for establishing the peace. So World Bank is a United Nations agency. It promotes peace, grants for peace, which promote peace. They improve the living standards of the population. So that is what is a World Bank. USAID. USAID is under the United States Agency for International Development. That is what is USAID stand for. So USAID is basically working for almost many areas. It is working for communicable diseases, combating communicable diseases. It is promoting water supply, sanitation and nutrition. MCQ for this is that USAID is funding actually malaria program. So a lot of work on malaria program is under the USAID agency. It is also funding the TB nutrition program. So nutrition and TB nutrition in TB and nutrition overall is from USAID. Next is identify the symbol on the screen. Of course, it's a Red Cross, so the name is Red Cross. So very difficult question sometimes we do get in the exam. Identify the symbol. Symbol is Red Cross. Red Cross was MCQ formulated by whom? Who started Red Cross? Red Cross was started by Sir Henry Durant. Henry Durant in 1864. So Sir Henry Dunant in 1864 formulated Red Cross. What happened was in late 19th century, there was more amount of cases, more war victims were there. So basically Red Cross was to provide first aid. That is what it was actually started with. To provide first aid in cases of disasters, in case of wars. In case of disasters, in case of war, we were to provide the first aid. That is what it was started from. In India, it has now started in every city, every state, but it was started in India from Bangalore and Karnataka. Next is identify the symbol. So of course in your exams they won't give you the answer with the symbol. So you need to identify the symbol. You can see half of the globe with the bits and squares like this. This is the symbol for Rockefeller Foundation. Rockefeller Foundation is a philanthropic foundation. Rockefeller Foundation helped in India to establish the All India Institute of Public Health, which is in Kolkata. Kolkata is in West Bengal in India. So AIIPH, that is All India Institute of Public Health, was formulated under the Rockefeller Foundation. Rockefeller Foundation, the director, the CEO, the board of directors is actually three of the main board of directors are Indians. So Rockefeller Foundation is pretty powerful in many countries, specifically in India. It works on many terrains. So I can't say that you'll get a question on it works in which terrain. So, but basically, if you ask me one answer, it works for upliftment of the rural areas. It works for giving them employment. Rockefeller Foundation is for employment. It works for power, electricity in the rural areas. It works for climatic change and water conservations, and of course, it has to work on health and disease and working on universal health coverage. These are all the main strategies under the Rockefeller Foundation. The headquarters of Rockefeller Foundation are in New York in US. Next is Ford Foundation. MCQs on Ford Foundation is basically for rural health in India. Rural health, we have Ford Foundation. Under the Ford Foundation, we formulated the National Institute of Health Administration and Education. Health Administration and Education, which is in Delhi, New Delhi. Ford Foundation is also was known to work for water supply and sanitation in West Bengal. Ford Foundation working for water supply and sanitation. Next is Bill and Melinda Gates Foundation. Bill and Melinda Gates Foundation is also a philanthropic society. It is working for many health diseases, specifically talking about TB. Almost all the TB managers, all the TB functions, all the newer TB drugs and the diagnostics are funded by the Bill and Melinda Gates Foundation in India. It is also working a lot of things in HIV. JE vaccination was done with support from the Bill and Melinda Gates Foundation, and we have a global alliance for vaccine and immunization. Gavi is also a body under the Bill and Melinda Gates Foundation. Next is SIDA, Swedish International Development Corporation Agency. This is funding our RNTCP. The tuberculosis program is funded under the SIDA program. DANIDA, this is Danish International Development Corporation. DANIDA was responsible for initiating the national program for control of blindness in India. It is also working for leprosy program. elements in RNTCP, that is National Tuberculosis Control Program. So all these programs are actually funded by many of the international health agencies. Next is CARE Foundation. CARE Foundation was started from North America in 1945. It takes care of many areas. CARE is basically for many areas, and predominantly it is for mother and child health, for tackling anemia in India at least, for taking care of women health, for taking care of adolescent health, and taking care of, CARE is known to take care of child health. So child health and anemia prevention can be your MCQs. Child health and anemia prevention can be your MCQs from CARE agencies. CARE has its office in Atlanta, Georgia, US. So these were some of your international health agencies. So obviously we have already talked, but just to recall about the offices, the WHO has its office in Geneva. Remember that the UNICEF has its office in New York. Next is UNDP. Although the name is United Nations Development Program, it has a logo of WHO. So remember, it's a bilateral agency, UNDP, and it has again its office in the New York. FAO has its office in Rome, and ILO, International Labour Organization, the Red Cross, all have their offices in Geneva. So these are some of the important questions you get. The theme for the WHO was our first slide. We started with it. The theme for the WHO is, for year 2019, is 19 to 20 is universal health coverage, everyone, everywhere. So we need to have health coverage for everyone, and it is possible only if everyone, everywhere walks and talks and thinks about universal health coverage. So that is what is the theme of the WHO. So with that, we finish off this topic on international health agencies. So next is, let's go back and see about the bioterrorism agents. Bioterrorism agents could be of many priorities. We are talking of bioterrorism agents basically of the high priority. So we can have high priority A, B and C. Mind the words that I am saying, all are high priority. A is known as highest priority. It is the first high priority, first highest priority. B is the second highest priority. And C is the third highest priority. The point is that I am not saying C is the lowest priority. Okay? C is not a low priority bioterrorism agents. It is not possible. Bioterrorism agents are a high priority. We can have a first highest priority, second highest priority and third highest priority. The first highest priority are meaning what organisms? First highest priority are most dangerous. Why? Because they are having high mortality and they have high morbidity and they have very huge public health impact. People create a lot of panic, media creates panic, governments change, the government is shaken, the country, society will be shaken. These are called as first high priority. High priority, high mortality, high morbidity, high public health impact, and these are requiring special action. They have to require special action, extra action by the WHO, by the UNICEF, by every organization in the world. Second are categorized as the second highest priority. What do you mean by second highest priority? In the second highest priority, they are also killing. It is not that this is low priority. No, this is second highest in priority. Why? Because these type of agents, they cause high morbidity. And thankfully, the mortality is not high. Mortality is normal. Like not normal, mortality is not as high as the category A. So mortality is lower compared to A category. But I'm not saying it is low mortality, it is lower mortality compared to A, but the point is it has high morbidity, and that's the reason we put diseases under category B, bioterrorism agents. And because they cause a lot of panic, media, and all these things. Now in category B, to combat category B, you need the government, the UNICEF, the WHO, UNDP, every international agency would need to have enhanced efforts for category B bioterrorism agents. In category C, these are third highest. They are priority. I am not saying these are low priority. They are high priority. They are the third highest priority. What happens in this area is they are again having high mortality, but they have maybe we don't know about morbidity, but which are the diseases which are under these. So in third category, you have the engineered microorganisms which may be used for mass destruction, in future. So currently there is no threat, but in future somebody can just trouble us by using these for mass destruction. So these diseases which may be engineered for mass destruction, they may have high morbidity, they may have high mortality, they may have high morbidity or high mortality. That is not material to us, but they will definitely have big public health impact. Therefore, these are third priority, not because of low morbidity or things like that. It is because you don't have them problem today. So what happens is category A bioterrorism agents, they spread very fast. They have very fast spread. Category B, that is the second highest, they have okay types of spread. Category C is category C because they are not spreading today. Are you getting it? It's the spread of disease which causes them into category A, B and C. A is high mortality, high morbidity, and they are a threat to us. These are pandemic diseases which if they spread, they cause pandemics. They will cause public health impact. So the bioterrorism agents which are under category A are classified as anthrax, botulism, plague, smallpox, tularemia, and viral hemorrhagic fevers like Ebola virus. So Ebola virus is a category A bioterrorism agent. We have Lassa virus, Machupo virus, but anyways, please remember smallpox, which had been asked in your MCQ exam, is not category C. Smallpox is not category C, it is category A agent, which is having high mortality, high death rate and high morbidity. It is categorized as highest priority, first highest priority. The category B are many diseases. I don't want you to go through all these diseases, but anyways, if you want to go through, you can go through brucellosis, food safety threats, epsilon toxin of the Clostridia perfringens, Glander's disease, melioidosis, psittacosis, Q fever, castor beans toxicity, staphylococcus enterotoxin, typhus, viral encephalitis, water safety threats, cholera, cryptosporidium, all these are category B. So you have couple of them, many diseases under category B, which are the second highest priority. But anyways, I'm saying it myself, this slide is not very high yield for your MCQ exam. It's just for your understanding purpose. Category C can be asked again. Nipah virus is under category C. Nipah virus disease outbreak we saw in May 2017-16, in 2017-18 in Kerala. So Nipah virus and hantavirus, these are categorized as category C emerging diseases. Next is what are the notifiable diseases under the international health regulations. Notifiable diseases, as you can see under the international health regulations, could be many. You need to remember them. Cholera, plague, yellow fever, smallpox, relapsing fever, rabies, salmonellosis, polio, influenza, SARS, malaria, and louse-borne. The point for us to remember is these are the notifiable diseases under the international health regulation. You need to remember which are under the international health regulations, and they are having a pandemic threat. The pandemic threat is for CYPIP, cholera, yellow fever, plague, influenza, plague, influenza, and poliomyelitis. So these are some of the diseases which are under the pandemic threat. They are under the international notifiable diseases under the international health regulations, which are having a pandemic threat. Other are not having pandemic threat, but they are kept under the international surveillance. These are notifiable disease. They are under the international surveillance. So international surveillance is for these all diseases. You can see around 12 diseases over here, but pandemic threat is for the 5 diseases: cholera, yellow fever, plague, influenza, and poliomyelitis. Another point which may be asked in your exams is regarding travel, international travel for pregnant females. Most of your domestic airlines, they have for travel for pregnant females is allowable up till 32 weeks. In certain airlines, it is up till 34 weeks also, but with reservations. But most of the airlines permit only if the pregnant female gestational age is less than 32 weeks. If you talk about the cruise travels, most of the sea travel airlines, not the airlines, the sea travel companies, the cruise companies, they'll ask the pregnant female to be below 24 to 28 weeks. 28 weeks with some reservations, but mostly they are doing below 24 weeks. So for airline travel, for your MCQ exams, you can remember 32 weeks, and for cruise ships, you can remember 24 weeks as the general cutoff line. Also, in regard to the international travel, there are certain countries which are called as yellow fever endemic countries. For travel to those countries, you need a yellow fever card. How will you get a yellow fever card? You get a yellow fever card only if you get a yellow fever vaccination. India is one of the countries which is yellow fever exotic country. What do you mean by exotic? Exotic means India does not have yellow fever. So therefore, any Indian person who wants to go to a yellow fever endemic country, example is South American countries, Africa, you need a yellow fever card. So to have a yellow fever card, you need to get a yellow fever vaccine. So it is mandatory that yellow fever vaccine needs to be taken. Yellow fever vaccine is a live vaccine. The strain is 17 Delta yellow fever live vaccine. Yellow fever vaccine, of course it has a teratogenic effect, but for pregnant females, if they are very importantly going to travel, yellow fever vaccine is still given. Yellow fever vaccine does not have a contraindication. In spite of the live vaccine, it is not contraindicated in pregnant females, although pregnant females are not at all advised to travel. But in case they have to travel, they have to take the yellow fever vaccine, because the country rules are, international rules are regarding the yellow fever vaccine. Yellow fever vaccine, this question can also be asked, that what is the valid time of the yellow fever vaccine? If you talk about yellow fever vaccine, it is valid after 10 days of vaccination. After 10 days of vaccination, it will be valid. It is valid for how much time? It is valid for lifetime. Earlier, guidelines were saying it is valid from 10 days of vaccination till 10 years, but now it is 10 days till lifetime. We say that yellow fever vaccine has to be given only once, but once given, you can travel to to the country. Next is, there is also sometime question regarding the Aedes aegypti index. If you talk about the Aedes aegypti index, the Aedes aegypti index means how many Aedes are flying in that area. So in the 400 meters, so within 400 meters, how many Aedes are observed or found? Aedes aegypti index is always kept as less than 1 for all international seaports and all international airports. Why do you think we do this? Because you already know that Aedes aegypti is a transmitter, it's a vector for yellow fever, and yellow fever is absent, it's exotic in India. We are scared of yellow fever epidemics, so therefore we ensure that all around the airports, the Aedes aegypti is not there. So these were some of your diseases of public health importance under the international health regulations. So with that, we have covered almost everything which may be asked in your international health regulations. Thank you so much.
Hi guys, please subscribe my channels.